There's a quiet betrayal happening in medicine cabinets across the country. A betrayal that most men over 60 feel deeply but never speak about. You take a pill to protect your heart, another to manage your blood pressure, maybe one to help you sleep. You do it because you're told it's the responsible thing to do. You trust the science. You trust your doctor. But then, something else begins to fail. A part of you that once defined your strength, your confidence, your very identity as a man, it goes silent. The connection with your partner becomes strained. The quiet confidence you used to carry begins to erode, replaced by a private, gnawing shame. You look at that little pill bottle on your counter, the one you take every single morning without fail, and you would never imagine it could be the very thing stealing your manhood. You blame your age. You blame your diet. You blame yourself. You never suspect the truth, that the cure might be the cause of the curse. What if I told you that this loss isn't an inevitable part of getting older? What if I told you it could be a direct, reversible side effect of the very medications you trust to keep you healthy? This is not a guess, it is a clinical fact, and the silence around it is causing millions of good men to suffer needlessly. Hello, I'm Dr. Julian Hayes. I'm 71 years old myself, and for 43 years as a urologist, I have sat across from thousands of men who have shared this exact heartbreaking story. Men who felt like they were fading away, not realizing they were holding the very cause of their decline in the palm of their hand every morning. My mission has always been to pull back the curtain on the truths that mainstream medicine often overlooks. Today, I will expose the 7 most common medications, both prescription and over-the-counter, that are secretly causing your erectile dysfunction. I will explain exactly how they sabotage your body, and I will arm you with the knowledge you need to have a confident, informed conversation with your doctor. Watch this video to the very end, because the information I am about to share is not just about restoring an erection. It is about reclaiming a part of yourself you thought was lost forever. Your story does not have to end in silence and frustration. It can end in strength and renewal. Let's begin. Before we dive into the specific medications, it is critical you understand why this is happening. Most men think an erection is a simple mechanical event. It is not. It is a complex symphony of healthy blood vessels, balanced hormones, and precise nerve signals. An erection is a sign of overall health. When it fails, it is the body's most personal warning light. And many modern medications, in their quest to solve one problem, inadvertently throw this delicate symphony into chaos. They can constrict the very blood vessels that need to open. They can interfere with the hormones that create desire, and they can scramble the nerve signals required for a physical response. I've seen it devastate even the strongest of men. Let's talk about Arthur, a 68-year-old retired accountant I treated a few years ago. Arthur was meticulous. He tracked his numbers, he took his pills on time, he did everything his cardiologist told him to do. His blood pressure was perfect on paper, but in the bedroom, there was only silence. He felt a deep sense of shame. He believed he was failing his wife. He blamed himself. He blamed his age. He never once suspected that the little white pill he took every morning was the thief. When we finally identified the culprit and his doctor switched him to an alternative, the change was not immediate, but it was steady. Weeks later, he came into my office, and for the first time in a long time, he looked me straight in the eye. "It's coming back," he said, his voice thick with emotion. "I'm coming back." Arthur's story is not unique. It is the story of millions, and it is the reason you need to know what I am about to share. Let's unmask the first and one of the most common hidden culprits. Number 1, thiazide diuretics, also known as water pills. These are often the very first drug prescribed to men with high blood pressure. They sound harmless enough. They work by helping your body get rid of excess salt and water, which in turn lowers blood pressure. It's a simple, effective mechanism, but it has a hidden, dark side. To get a firm erection, your body needs to pump a massive volume of blood into the penis. But these diuretics, by their very nature, reduce the overall fluid volume in your body and can decrease the force of blood flow to your extremities. Think of it like trying to fill a water balloon from a garden hose that has low pressure. You can turn the knob all the way, but if the pressure isn't there, the balloon remains limp. Over time, this reduced blood flow can also cause the smooth muscle tissues in the penis to lose their elasticity and even atrophy from lack of use. I remember a patient named George, a 70-year-old avid golfer. His doctor put him on a common water pill, and his blood pressure numbers improved beautifully. He felt great on the golf course, but at home, his intimate life with his wife of 45 years came to a complete halt. He was confused and frustrated. The very pill that was supposed to be protecting his cardiovascular system was destroying his most personal connection. He thought it was just the price of getting older. It was not. It was the price of the pill. When we discussed this, he was empowered to speak with his doctor, who was able to switch him to a different class of medication. It took time, but George eventually got his life back, both on and off the golf course. If you are on a water pill and have noticed a change, you are not imagining it. Number 2, beta blockers. This is another massive class of drugs used for high blood pressure, heart conditions, and even anxiety. Names like metoprolol or atenolol are incredibly common. They work by blocking the effects of adrenaline, which slows the heart rate and reduces the force of its contractions. This is excellent for an overworked heart, but it can be devastating for an erection. Beta blockers don't just work on your heart, they work on your entire nervous system. They can dampen the nerve impulses that are essential for achieving an erection. They create a kind of neurological static, making it harder for the brain's signals of arousal to reach their destination. But it gets worse. Research has shown that some beta blockers can also interfere with your hormones, specifically by making it more difficult for your body to use testosterone effectively. Some studies even suggest they can modestly lower testosterone levels over time. So you have a triple threat: reduced blood flow from a slower heart rate, scrambled nerve signals, and hormonal interference. It is a perfect storm for erectile dysfunction. I think of David, a 65-year-old grandfather who was put on a beta blocker after a minor heart scare. He told me it wasn't just the physical issue. He felt emotionally flat. The medication seemed to blunt not just his blood pressure, but his feelings, his excitement, his libido. He felt like a ghost in his own life. The connection with his grandchildren was still there, but his intimate connection with his wife faded completely. It was only after we identified the beta blocker as the likely culprit that he felt a sense of hope. His doctor adjusted his treatment, and slowly the color began to return to his life. Beta blockers can be life-saving drugs, but you must be aware of their potential cost to your vitality. Number 3, SSRIs, a class of antidepressants. Depression, grief, and anxiety are incredibly common in older men, especially after retirement or the loss of a spouse. Seeking help is an act of courage, but the most commonly prescribed solution, a class of drugs called selective serotonin reuptake inhibitors, or SSRIs, often comes with a cruel irony. These drugs work by increasing the amount of serotonin in the brain, which can lift your mood. But serotonin also acts as a brake on dopamine and norepinephrine, two neurotransmitters that are absolutely essential for libido, arousal, and orgasm. When you increase the brake pedal, you inevitably decrease the gas pedal. For many men, this results in a devastating trade-off. Their mood might stabilize, but their desire vanishes. They lose the ability to feel aroused, and even if they can, reaching a climax becomes difficult or impossible. Michael, a 72-year-old widower, came to me after his wife passed away. He was deep in grief, and his doctor rightly prescribed an SSRI to help him through the darkest days. It helped him get out of bed in the morning, but it also erased any semblance of his physical self. He told me, "Doc, I lost my wife, and then this pill made me lose the rest of myself as a man. I don't feel sad anymore, but I don't feel anything at all."
If you are finding this information valuable, and if it is shedding a light on something you may have been experiencing in silence, please take a moment to comment the word "yes" below, just so I know this message is reaching you. Your feedback is more important than you know. Thank you. Now, let's continue with the fourth culprit, one that many men take to ease their minds without realizing it could be putting their bodies to sleep. Number 4. Benzodiazepines. These are powerful medications prescribed for anxiety, panic disorders, and insomnia. Names like Xanax, Valium, or Ativan are well known. They work by enhancing the effect of a neurotransmitter called GABA, which is the body's primary off switch. It calms the nervous system, reduces anxiety, and induces sedation. But that sedation doesn't just affect your mind. It affects every nerve in your body. It can significantly dull the sensations and reflexes required to achieve and maintain an erection. Libido often plummets because the brain's arousal centers are essentially being told to stand down. Furthermore, these drugs can cause muscle weakness and fatigue, making the physical act of intimacy feel exhausting. I once treated a patient, Frank, a 69-year-old man who struggled with terrible insomnia after retiring. His doctor prescribed a benzodiazepine to help him sleep. It worked, but Frank told me he felt like he was walking through his days in a fog. He said, "I'm sleeping, but I'm never truly awake. And the part of me that used to feel desire, it's just gone. It's like the pilot light went out." The very drug he was taking to restore himself at night was draining his vitality during the day. It's a vicious cycle. You feel anxious, so you take a pill. The pill causes sexual side effects, which makes you feel more anxious and depressed, and the cycle continues. Recognizing this connection is the first step to breaking free. Number 5. Antihistamines. This one surprises almost everyone because it's not a powerful prescription drug. It's something you buy over the counter. I'm talking about common allergy and cold medications, especially older ones like Benadryl, and many PM sleep aids that contain the same active ingredient, diphenhydramine. These drugs have what we call strong anticholinergic effects. In simple terms, they block a neurotransmitter called acetylcholine, which is critical for countless bodily functions, including blood vessel dilation and the transmission of arousal signals. When you block this compound, you are directly interfering with the physiological requirements for an erection. It's usually a temporary effect, but for an older man whose system is already more sensitive, or for someone who takes these medications regularly for chronic allergies or to help with sleep, the impact can become significant and chronic. It's a hidden danger in plain sight. A patient of mine once came to me completely baffled. He was in his late 60s, healthy, and had a great intimate life. Then suddenly, over a period of a few weeks in the spring, he developed erectile dysfunction. He was panicked. We went through everything and nothing had changed, except for one thing. He had started taking a daily over-the-counter antihistamine for his seasonal allergies. He never would have made the connection. Once allergy season passed and he stopped the medication, his function returned to normal. He was immensely relieved, but also angry that a simple, common pill could have such a profound effect without any warning on the label. Never underestimate the power of the pills you can buy without a prescription. Number 6. Statins. Here we enter a controversial but important territory. Statins are among the most prescribed drugs on the planet, used to lower cholesterol and reduce the risk of heart attack and stroke. They are, for many people, life-saving medications. However, there is a body of evidence and a mountain of anecdotal reports suggesting they can contribute to erectile dysfunction. The science is complex, but the leading theory is this. Testosterone, the primary male hormone, is manufactured in the body from cholesterol. Statins work by inhibiting your body's production of cholesterol. While they primarily target the liver, it is plausible that they can also reduce the available building blocks for testosterone, leading to lower levels over time. Lower testosterone directly translates to lower libido and weaker erectile function. Many men on statins report a gradual fading of their energy, their muscle tone, and their sexual drive. They are proud of their excellent cholesterol numbers, but they feel like a lesser version of themselves. Robert, a 67-year-old patient, put it perfectly. He said, "My doctor is thrilled with my blood work. My cholesterol is the same as a teenager's, but I feel like my strength, my power, has been drained out of me." He was caught in the classic medical trade-off. The conversation around statins is not about telling you to stop your medication. That would be incredibly dangerous. It's about awareness. If you are on a statin and have experienced these side effects, it is a valid and important issue to discuss with your doctor. Sometimes a change in dose or a change to a different type of statin can make a significant difference. You do not have to accept this as an unchangeable fate. Number 7. Long-term use of NSAIDs. This is the final and perhaps most insidious culprit because almost everyone sees them as completely harmless. I'm talking about non-steroidal anti-inflammatory drugs. Common names are ibuprofen and naproxen. We take them for headaches, for muscle soreness, and most importantly for seniors, for chronic arthritis pain. A pill here and there is not the issue. The danger comes with long-term, daily, high-dose use, which is very common among men managing chronic pain. Recent studies have begun to uncover a frightening link. One major study found that men who regularly used NSAIDs were significantly more likely to report erectile dysfunction than men who did not. How does this happen? The mechanism is still being studied, but it appears to be twofold. First, these drugs can interfere with the body's production of prostaglandins, which are compounds that help blood vessels relax and dilate. This can lead to impaired blood flow. Second, there is emerging evidence that long-term NSAID use can negatively impact testosterone production. It's the ultimate irony. A man takes a pill every day to manage the pain in his knees so he can stay active, to only find that it may be causing a different kind of pain, a more private one, by sabotaging his sexual health. An older gentleman managing his arthritis told me he felt stuck. He said, "If I don't take the pills, my joints ache so much I can't move. If I do take them, I feel like a lesser man of myself." This is the kind of impossible choice that millions of men are facing in silence. But silence is not the answer. Knowledge is. You now know about the 7 most common medication traps. The water pills that reduce blood volume, the beta blockers that scramble nerve signals, the antidepressants that kill desire, the anxiety pills that sedate the body, the hidden danger of antihistamines, the hormonal heist of statins, and the inflammatory irony of pain pills. This knowledge is not meant to scare you, it is meant to empower you. The goal is not for you to stop your medications. That could be incredibly dangerous. The goal is to transform you from a passive patient into an active, informed partner in your own healthcare. Imagine walking into your doctor's office not with shame, but with knowledge. Imagine being able to say, "Doctor, I understand why I'm taking this medication, but I'm experiencing side effects that are impacting my quality of life. I've learned there may be alternatives. Can we discuss them?" That single conversation can change everything. It can open the door to a different prescription, a lower dose, or a complementary lifestyle change that could restore the vitality you feel slipping away. Imagine reconnecting with your partner not with anxiety and fear of failure, but with renewed hope and confidence. Imagine waking up in the morning feeling not just rested, but whole. This is not a fantasy. It is possible. You are still the man you have always been. Your body has not forgotten how to function. It may just be that something you are doing to help it is inadvertently holding it back. Now that you know the medications that can cause this damage, it is absolutely critical that you learn about the everyday foods that can begin to heal it. In my next video, I revealed the top 3 foods that boost circulation down there, helping to counteract some of these very side effects. I urge you to watch it immediately. But before you go, I want to hear from you. Your story and your voice matter in this community. In the comments below, tell me which of these 7 medications surprised you the most